The history of novel viruses in the United States goes back a long time. The best model is 1918. The communities that did the best exercised social distancing. That was the only tool they had, and that's approximately the only tool we have, and that's fine. We know what works. Do not be conned into thinking there are magical cures out there. Our best guidance is social distancing. Keep your distance, stay at home unless you have somewhere to go, and then let's talk about what you do then. We have had in the news recently a lot of information about masks, and there's been some debate, and I think there has been a pivot towards possibly everybody using a mask. And I want to go through the kind of masks that are available and what you should and should not do. So in front of me, I have a series of masks that I'm going to demonstrate for you, at least briefly, and discuss who should use them, who shouldn't, and why. The first one, I have two models, but it's the same one. It's an N95 mask. It comes in blue or white, and it just fits very comfortably like that. It is only for medical personnel and people who are first responders. It should not be worn for anybody else. These are in extremely short supply. If you start to just use these willy-nilly, you are going to probably, in the end, deny the use to a first responder, and if they get sick, you have no one to turn to. So these are forbidden to be used by anybody else if at all possible. You are doing nobody any good by using these. They are extremely good masks, but they are that good for a reason. They protect your first responders and your healthcare workers, and they are at the moment very, very, very short supply. Along with that come surgical shields. This is a very flimsy model that has been around for a while. This is a newer model that's actually being produced right here in Brockton and is an extremely good shield. Again, these are not to be used by anybody but first responders in situations where there is a risk of spray or aerosolization of mucus or sputum or sneezing, and they should not be used by anybody else. They are in extremely short supply, and you should not have these. These are a surgical mask, which those of you who've had surgery have seen your surgical nurse and your doctor use. They are actually a very good mask. Again, extremely short supply, should only be used by medical personnel, first responders, but if you have an underlying immune compromising situation, are on chemotherapy, or you have COPD and are extremely respiratory distressed, if you have been told by your doctor to use this because you have MS or anything else that has disturbed your immune system, these should be used by those people as well. But don't drive in your car with it. Wear it when you're going to be exposed. They have fairly good protection against other people's breath or cough or sneeze. And they are, but again, in very short supply, so do not use them unless you're a healthcare worker or are immune compromised. Then there's my last one, which I really like. One of my staff gave it to me. It's got flamingos on it. And this is the homemade variety. This is what you should be using. And actually, as of today, I think you're going to see nationally, it's going to be recommended. Now, what does it do? For you, nothing. For everybody else, something. It's going to protect your spray, your breath, your sneeze, your cough from reaching 10 or 15 feet or 6 feet away and protect everybody else in the community. You can almost see through these. The holes in them are so large that you're not going to get very much protection from anybody else. But you're going to do a community service. You're going to be a very good citizen by protecting everybody else. The latest data, they suggest that 30% of people with COVID-19 have no symptoms, but are out there as super spreaders, infecting people, and it's not of their own volition. They just don't know they're sick. Wearing these will protect the population from the possibility that you're one of those folks and are spreading it without knowing it, because this will interfere with a droplet that you create if you cough or sneeze or just breathe or sing. And that will not go very far once it hits your mask. So you're going to do the community a great favor by wearing this and protect your neighbors. Again, it will not do very much to protect you, but the recommendations are that if we start to protect our neighbors, we may really improve the statistics that we're seeing.